It's a global health crisis now hitting close to home. Coronavirus is in Florida, and we're here to help you separate fact from fiction and help you keep you and your family safe. You're watching an Eyewitness News special, Coronavirus, Your Questions Answered.
Hi, folks. We are dedicating the next hour to bringing you crucial information about what's happening with coronavirus and our community. Good evening, and thanks for joining us. We are live here tonight. I'm Greg Wormuth.
And I'm Martha Sagowski. We know this is a subject that just so many of you are talking about right now and watching so closely. We have a team of reporters gathering the very latest information on what's happening with the illness and infections across the country, what local schools are doing to protect students, and what this all means for people traveling into or out of Central Florida.
And you can see behind us, we have gathered public health experts and local government, school, and transportation leaders. They'll be here to answer questions that you've sent in and talk about what's being done here at home. We appreciate all of you being here tonight, and we'll talk with you. And Vanessa Eccles will have some questions from our viewers in just a moment. We'll also want to hear from you. You can reach out on social media as well.
That's right. You can call our media partners at News 96.5. That number is 844-220-0965. Now, at this hour, we know a total of 9 people linked to our state, Florida, have COVID-19. Today, Governor Ron DeSantis announcing 5 Florida residents are held up in Washington because they have tested positive.
He also said a man in Santa Rosa County, now that is in the Panhandle area, is presumptive positive for the virus. We're joined now by Channel 9's Lauren Seabrook, who has followed every new development in this major story since early last week. She's in the studio with us tonight, as you can see. And Lauren, state health officials continue to say the risk here, right where we are, is low tonight.
Right, Greg. And they also say even if you do get it, it likely won't be that serious for you unless you are elderly or if maybe you have some underlying medical issues. But out of nearly 100,000 cases worldwide, about 3,300 people have died from this virus. Here in the U.S., we've had about 100 cases and 10 deaths. Thankfully, though, here in Florida, no one has died. Before COVID-19 traveled around the world, it started in Wuhan, China. On the very last day of 2019, a patient there became ill with pneumonia. A week later, it was identified as coronavirus. And 2 weeks after that, on January 21st, it was in the United States. The outbreak was then declared a public health emergency of international concern.
I was thinking, when's it going to happen? I actually thought it would hit Florida first of all.
Washington was actually the first state with a positive case, and it wouldn't be long before we had one here. The first positive test in Florida came Saturday, but the State Department of Health didn't announce the case until late Sunday.
In terms of letting the public know that this is coming and how to prepare ourselves, and
Monday, the state declared a public health emergency to get resources ready to handle the threat. By Tuesday, we had 3 cases in our state. A man in his 60s in Manatee County who was in the hospital with pneumonia had not recently traveled out of the country, and health officials are still investigating how he picked it up. The other 2 cases are sisters in their 20s who recently traveled to Italy, and now a man who lives in the Panhandle and has severe underlying health issues has it too. Orange County health officials say as testing is expanded here, we might be next.
We believe it is a matter of time before we have a case right here in our backyard.
A vaccine is currently under development, but Florida Surgeon General says it's more than a year away from being ready. So far, the virus has been fatal in 2% of cases, but
if you don't have an underlying health condition and you're not elderly, so far, you've seen very few really serious cases.
A recent study published in the New England Medical Journal also says it appears children under the age of 15 might be resistant to it.
The folks here at Orange County Health Department, they've been in contact with Disney, the other theme parks, the hotels. They are going to be in further contact with senior citizen nursing homes and assisted living facilities.
Now, we also learned today the federal government is sending tens of thousands of test kits to Florida so they can start testing people in hospitals and doctors' offices. We've been waiting for that for a while.
Now, Lauren, this response is already adding up for our state. The governor already said that we'll likely have to be dipping into the state's reserves.
Right, Martha, but he also said that he believes all of Florida's expenses will qualify for federal reimbursement, so we'll have to wait and see how that turns out.
It is kind of our next hurricane in terms of our preparedness, the money we're going to have to spend and to keep people safe. It's very similar. Thank you, Lauren, for that report.
All right, we've also been asking you, what questions do you have about coronavirus and the work being done right now here in our community to contain it?
So let's get your questions answered right now. Channel 9 anchor Vanessa Eccles has been monitoring our social media accounts all week long, and we're hearing from viewers like you. My email has also been generating some questions. And Vanessa, you're going to answer some of those questions with our expert panel.
Yeah, a lot of questions, and we have you covered with both top local leaders and medical experts. We're joined tonight by Orange County Mayor Jerry Demings, Dr. Yolanda Martinez, Orange County Director of Health Services, Dr. Timothy Hendricks, Medical Director at Advent Health Center Care, Dr. Asim Jani, infectious disease expert with Orlando Health, Phil Brown, the CEO of Orlando International Airport, and Teresa Jacobs, the school board chairwoman for Orange County Public Schools. And Mayor, I want to walk over here and start with you just for an overview here. Greg mentioned something about hurricane preparedness, and I know the county has a plan when we're dealing with weather emergencies. Is there a county plan for something like this when we have an infectious disease?
The short answer is yes. We have very robust plans to be able to contemplate whatever situation we have to deal with. In fact, earlier this week, there was a joint exercise between the city of Orlando and other stakeholders here within the community, and we try to make certain that we're as familiar with those plans as possible.
And I know you said today Orange County is open for business. That was a message you were stressing. Let's get now to our first viewer question. Here's the question. How do you test a person for COVID-19? Dr. Martinez, if you will address that. How do you test somebody for this?
Well, the test is very simple. It entails a nose swab, a mouth swab, and if the person has a cough and is productive, a sputum sample.
And what happens to it then?
The health department is the agency right now collecting those samples, so they package it and they send it to the lab that is doing the testing right now in Jacksonville. It takes between 24 and 48 hours for the results to come back.
All right, let's go to our next question now, which is, how does one know when to go get tested? So Dr. Hendricks, if you will address that. How do you know, like, I think I need to get tested for COVID-19?
Well, right now, CentraCare and all of our providers at Advent Health are following CDC standards for testing, and that would be people that have risks. So if you've recently traveled to one of the affected countries, the 5 countries plus China that are listed at a high alert right now, or if you've come into contact with somebody that has COVID-19 that has been confirmed, that doesn't leave a lot of, that's a very small group of people. So the odds of you actually needing testing is exceedingly low right now. But if you meet those criteria, we contact the health department and they will give us guidance in terms of getting testing moving forward. Our hope is that soon we'll be able to progress to more readily available testing available in offices, but that's several weeks out, I'm sure.
And again, the thing that you stress, if you know someone has it for sure.
Right. So just because you have a cough or fever right now, you more likely have the flu right now. You don't have COVID-19.
All right, we have another question here. Can the virus that causes COVID-19 be spread through food? I think for that one, if Dr. Johnny, if you can address that, how is it spread? Can it be spread through food?
So the primary route by which one gets exposed and infected with this virus is through the respiratory tract, through inhaling droplets from someone who has been too close to you in terms of sneezing and coughing and who might be infectious, contagious. It is not acquired through food.
All right. Now, also, our radio partners, we're going to let you know at News 96.5 WDBO are also taking your questions. Let's check in now with Joe Kelly.
Vanessa, we just heard from Sharon in Apopka. She called us up at 844-220-0965. And she asks, I heard that the COVID-19 can stay on money for 9 days. Is that true? Should I not use cash?
That is a great question. Dr. Hendricks, do you have the answer to that?
I would say that there is not enough information about how long the virus can stay on surfaces, how long it can survive. But it's exceedingly unlikely that it's going to survive on your money that long. But it just reminds us that if it can survive on a surface, the best thing you do is regular hand washing. Go ahead and use your cash, use your credit cards, but be wise, and frequent hand washing will prevent that, because we also have to wipe down surfaces and just get into that habit to prevent transmission.
We're actually going to show a video of the proper way, Joe, of how to wash hands coming up. Any other questions from the callers?
I do. I've got another question here. This one's from Cheyenne and Oviedo, and this kind of reminds us of the Zika issue we had in the last few years. How at risk are pregnant women and newborn children?
Dr. Johnny, you want to hit that one?
Sure. There is currently certainly a lot of information that we still have to obtain from patients who might be having been exposed and infected with coronavirus. But we know right now that there's no extra risk for pregnant women through their gestation period to get coronavirus. There's also no real evidence that this is transmitted through breast milk. It requires close contact, and that's the main thing that people should be aware of.
All right. Good information. Thanks so much.
So you see, this is a great opportunity for folks. Questions answered. We'll be looking for your questions over the next hour. You can reach out to us on our social media pages right now, in fact.
They've been sending me some too, so I might just hand those in.
There we go.
So
a whole list right now.
Really have a lot of questions. Thank you all very much. Thank you, Vanessa. Thank you, Joe. Thank you to the listeners on News 96.5. This is an important show. If you've got questions, hit us up. We'll do the best we can to answer those live. Stay with us. Our coverage continues right after the break.
Welcome back. Whenever we get sick, we see a string of the same symptoms, including a runny nose, coughing, and congestion. Now, one of the highly asked questions we're hearing is how to tell the difference between the flu and the coronavirus, especially because we are still in the flu season.
And let's not forget, I talked to Tom Terry, our chief meteorologist, about that. We're also in allergy season as well. Channel 9's Sarah Beth Ackerman spoke with a doctor to break down exactly what you should be paying attention to.
The problem we see quite often is the symptoms between viruses are similar. With the flu, we typically see this.
Runny nose, cough, congestion, higher fever. Those symptoms usually come on suddenly. And then also the classic body aches. I feel yucky, and the person is down for the count.
With the coronavirus, doctors have narrowed the symptoms down to this.
Cough, runny nose, and then you get into difficulty breathing. And I would say that would be the biggest difference.
Also, the biggest message.
Most people do okay with this. About 80% of cases, people recover and they're doing okay. We never want to see deaths, and that is happening, but at a smaller percentage, okay?
Dr. Jones recommends listening to your body, staying on top of your symptoms, and call a doctor if you're concerned, but pushes the reminder of calling first. Even if your symptoms are just the common cold or the flu, they're trying to cut down the spread. Allow your doctor to be the deciding factor of where or when you should go.
I'm saying it over and over again to multiple patients a day.
With the coronavirus information updating each day, questions from your children are likely shuffling in. Dr. Jones says as a parent, it's our job to stay calm. That will translate to your son and or daughter.
It is totally understandable to be feeling overwhelmed right now. But the message is to plan, not panic.
If the anxiety is still there, get ahead of it, especially in the planning department.
Just in case things start to shut down, for example, if you're going to be at home and not going out in public per se, make sure you have your medications. Make sure you have what your family would usually need for about 2 weeks.
Reporting in Orange County, I'm Sarah Beth Ackerman, Channel 9 Eyewitness News.
So important. So many kids, and you have 6 of them, 3 little ones, anxious right now. And the one thing I want to ask, again, our superintendent of Orange County Schools, Teresa Jacobs, is with us. Parents know if their kid has the sniffles, know if they're sick. Are you having a problem with parents just sending those sick children off to school? And what is your word to them tonight?
I do have advice on that. You know, I think as parents, so many of us are accustomed to just feeling like perfect attendance is what we need for our kids and send them to school and, you know, tough it out. That's not the right attitude to have in this environment, and we have to adapt to the environment. So we really need our parents, if the kids are sick, keep them home. Even if you're certain it's not the coronavirus, but they're under the weather, they have a runny nose, they have a cough, keep them home if you can possibly keep them home. And that does a couple of things. One, that helps to reduce the possibility that we could have a spread in the event that they somehow came in contact with it through community spread. But it also is an anxiety issue throughout our community. And I think we're all going to find pretty quickly that when we're around people that are coughing and sneezing, we're getting nervous. So for the good of your child, keep them home, let them rest and recover at home, and send them back to school when they're better.
And I've been getting some questions from our followers and our viewers about traveling and going to the airport. We have so many, 75 million tourists that came through our area last year. And I want to go now to Phil Brown, the CEO of Orlando International. You all have already taken the steps of adding more hand sanitizers at the airport. What do you see happening next, or do you feel that that's enough right now for us?
At this point, we're actually trying to acquire some more so we can get it further dispersed throughout the airport. But people are using it. We have it at the checkpoints on the backside of the checkpoints. We have it at the food court. And what we're trying to do is what everybody else is promote good hygiene, wash your hands, use hand sanitizer when you can. You know, we're a crowded airport. We have 50 million passengers annually. We just need everybody to take some ownership and responsibility for making sure that they're not spreading germs. And that's what we're asking people to do.
Very good, Phil. And Jeff Deal went out to the airport. He also talked to the airlines about what they're doing on those planes. So, again, we'll touch on that a little bit. But let's now go back to the questions that folks have sent in to us.
There are a lot of them. One of them I know is, what's the timeline for developing a coronavirus vaccine at this point? Is it going to happen in a few weeks, or is it going to take longer to develop this?
Dr. Johnny?
So most people think that it will be at least 12 to 18 months. There are some more favorable estimates that it might be later this year, but I'm sure that we will have one, but it will take some time.
All right, Dr. Hendricks, we know everyone has hand sanitizers, it seems like, on their desk. We walk by anyone we see and boom, you hit it. But it's better warm soap and water, correct? And there's a correct way to do it, almost like scrubbing in for surgery?
Right. I mean, the best way to reduce bacteria and viruses, those microbes on your hand, is to use soap and water. And we're talking about a good 20-second wash, singing the happy birthday song twice through. We've heard that over and over again. But it's about getting that friction in there, washing really well, and rinsing off. And then as you exit the bathroom, use the paper towel to touch the handle, because these high-touch areas are where those viruses are transmitted.
I have a timer now for my little ones, because they used to do the quick squirt of soap and then right under the water, and that's it in 5 seconds. I'm like, guys, we have to stay, we have to count, we sing a song and make sure that they get all their hands covered with soap and rinsed off.
Right, and don't forget the thumbs. Do a little thumb twist, get the backs of the hands. You have to get all areas of the hands.
Okay, another question is, how long does it take one who is otherwise healthy, a lot of folks healthy, not immune compromised, how long does it take a healthy person to recover from the virus, and how long typically until they aren't contagious anymore?
Well, I believe, and Dr. Johnny can probably correct me, but I believe it's it could be 2 to 3, maybe even 4 weeks for somebody. Now, more severe infection may take up to a month. These are hospitalized patients, but most people will probably be a week to 2 weeks, typical like the flu range of time. And it's assumed that once you've recovered, that you're no longer transmitting.
Correct.
It's important. We talked to former Governor Rick Scott, now Senator. He said that his advice to Ron DeSantis and other public leaders, and I know Mayor Demings, you were also public safety director for a time in Orange County, but to let people know what is happening is important. And today, what I think you said in the news conference we showed live here on Channel 9 is it's just a matter of time before we do have a case here in Orange County and in Central Florida, right?
Well, I think I'm going to be cautiously optimistic. We don't have a case here now, but the ultimate goal, what we're trying to do is be proactive so that we don't have a case here. And if we all work together and really adopt all of the different things that our healthcare professionals are telling us, we can reduce the likelihood that we'll be impacted.
All right, we're going to hit all of y'all continually, but we've got more questions that are coming in from our viewers online, social media, emails, phone
Twitter,
calls.
Instagram, Facebook,
we are
all
here
of
for
it.
you. Again, this is live tonight, answering your questions about coronavirus.
Stay with us. Our coverage will continue right after this quick break.
Welcome back to our live coverage here of coronavirus. Obviously a big concern for folks who travel.
And Orlando International Airport is always busy, especially right now with all the spring breakers heading in and out of Central Florida. Channel 9's Jeff Deal has a look at how the airport is preparing.
The airport does have a plan in place. Fortunately, they haven't had to put it into action yet. So right now, they're just focusing on cleanliness. They have a much more rigorous cleaning schedule. They're focusing in on places like the restrooms, but also the common areas, places where people might actually sit down and touch some things.
For travelers moving through Orlando International Airport, coronavirus is definitely on their minds.
Especially because now it's more widespread in the U.S.
Morgan McDougal has a mask because she says her immune system is weakened. But there does not seem to be any sense of panic here, and there shouldn't be, according to Tom Draper, Senior Director of Airport Operations.
The airport has been monitoring the coronavirus ever since the initial outbreaks.
And what they've been doing is developing an emergency plan and training for response should coronavirus come to OIA.
Airport's Fire Rescue Division would be the lead. Of course, law enforcement would be supporting, operations would be supporting, but also the Department of Health would be involved in that. The CDC would be involved in that.
The first responders are carrying more protective gear like masks in case they come in contact with anyone sick. Right now, OIA doesn't have direct flights with any of the hot zones for coronavirus, and it's not one of the airports currently screening incoming passengers. But the airport has increased cleaning and added cleaning staff for restrooms and common touch point areas. They've worked with TSA on extra cleaning too. They've also added hand sanitizer stations just past the security checkpoints.
I think just being cautious and definitely washing my hands, keeping hand sanitizer, that kind of thing.
And even though we don't have screenings for coronavirus here in Orlando, airport officials do say as part of their regular customer service, they will reach out and try to assist people who appear to be sick. Reporting at Orlando International Airport, Jeff Deal, Channel 9 Eyewitness News.
All right, Jeff, it's time now to check back in with our panel of guests. Orlando International Airport CEO Phil Brown is still in our studio, of course.
He is, and one of the main questions that we've been getting from you, our viewers, and is it safe, Phil, to go to the airport and travel during these times? And should travelers be taking any extra precautions when they get on an airplane?
Well, it's safe to travel, and passengers need to take precautions that they would normally take. You have to assess your own health. If you're at risk for this, then you may want to consider that. But for somebody that's not at risk, and when I say at risk, it's people like me that are past 65, they're mostly at risk. So you have to consider that. But it's safe to travel. We take extra care to make sure that we're stepping up cleaning, as you've already reported. And the airlines are also doing their part. They're looking at ways to make sure that their aircraft are clean, that they're extra clean when they fly. And so everybody wants to take care of the passengers and their customers.
Yeah, it's a nightmare for the economy of that business if, in fact, people get sick by flying. Let's talk about on the ground now. And Dr. Martinez, a lot of us take rideshare, whether that's public transportation like a bus or Uber or Lyft. Should we be alarmed and concerned about that?
I think the situation is very similar to traveling in an airplane. The risk is very low right now in Central Florida. So as long as we take the precautions, as we've been mentioning, of washing your hands, what you touch, using hand sanitizer, we should be safe. So there shouldn't be any problem using shared ride.
We've been getting, I got another question from folks concerned that everyone's buying up these face masks. You're expert here. Do people really need those?
I say no. I mean, for the general population moving around, walking through the community, traveling, they're really going to give you a false sense of security. And I remind people that, we train our staff at the hospital at Centricare on how to use these masks appropriately, and simple things like washing your hands before you take the mask off. You've touched a surface, now you've contaminated your face. So there's a lot of complexity in that question, but our biggest concern is people buying up the mask or taking them away from our ability to stock them for our first line staff that are taking care of patients. So that's a bigger issue.
Dr. Johnny, a heartfelt email came to me about this. This person says they have a weakened immune system. They feel like they're at a high-risk group. And their question, which is multifold, says, how long can the virus live outside the body? Once someone sneezes, let's say, for an example, in an elevator, how long does the virus live in those droplets?
So this is similar to the question of how long does the virus exist on surfaces. Clearly, during a sneeze or a cough, these particles travel through the air. They generally have a trajectory of falling onto the ground or onto the surface within a 3 to 6 feet period of, a distance. And so it's really important that during any time that someone's observing in their environment that someone is really coughing, sneezing, to stay at least 6 feet away from them. In terms of how long the virus would actually stay on those contaminated surfaces, clearly right after a sneeze, right after a cough, if there's any sort of wet material that's going to persist. Again, it may be several hours while these organisms may be there, but we really don't know.
Again, it has to find that pathway, and that's by touching your face. So again, continually washing your hands, and if you do come in contact with any surface, just keep your hands washed, keep your hands off your face. That's the bottom line. We're going to continue our coverage here. A very important issue for all of us. There's so many questions that I have, I know you have, and that you have. We'll be right back after a quick break.
This is an Eyewitness News special, Coronavirus, your questions answered.
Welcome back to our Eyewitness News special. We have another half hour to go, and we're trying to answer as many questions about coronavirus as we can. You have them, I have them, but first, we want to get you up to date with today's developments.
This afternoon, the Senate overwhelmingly passed an $8.3 billion emergency funding bill to fight this illness. And while Congress is taking action, of course, the real fight against coronavirus may happen here on the local level. Channel 9 Washington, D.C. reporter Blair Miller spoke with Senator Rick Scott of Florida about what he thinks local and state leaders should be doing right now.
Senator Scott and I spoke at length about what he says needs to happen. He says now is the time for state leaders to really be clear on what they're dealing with and what they don't know. Florida Senator Rick Scott knows the challenges.
I had hurricanes, I had Zika.
He was governor when the Zika virus swept through a few years ago. In his office, he told me there are a few things local and state agencies should be doing right now.
What is your biggest one thing of advice to governors or mayors right now?
I think the biggest thing is whatever you know, get it out. Whatever you don't know, tell people. You don't know.
He's fielding questions from his own family, asking how serious the coronavirus is. He says keeping the public informed may be the best way to avoid any chance of panic.
Get information out there, keep the public informed, make it easy to get a hold of you, so when the public has questions, you know what they're asking, and so you can go get the answer.
Other senators say states need to do a few things. Have test kits available at doctors' offices and clinics. Make sure medical professionals have the proper protective gear. And government leaders should track the costs on these things so the federal government reimburses states.
At this point, do you think the federal government has done enough?
Well, I think, the president did the right thing when he did the travel ban. And that's pretty unheard of, so I think that's a big deal.
But Senator Scott then told me he still thinks other federal agencies need to be more transparent so people aren't caught off guard and don't panic. In Washington, Blair Miller, Channel 9 Eyewitness News.
All right, Blair, thanks. And we spoke with Congresswoman Stephanie Murphy as well, who represents Florida's 7th district, covering all of Seminole County and much of northern Orange County.
She told us about the impact the spending bill will have in developing a vaccine.
The other thing is to try to expedite the development of both therapeutics as well as vaccination. So money will go into the research and development of those types of things. We also want to make sure that communities that are preparing for this potential pandemic or virus outbreak are reimbursed for some of the efforts that they put in. It's a bit like preparing for a hurricane. We know that communities expend a lot of money in that preparation, and we want to make sure that they have the resources to do so.
Now, we also spoke to Congressman Michael Waltz today.
He represents Florida's 6th district, which includes Flagler and Volusia counties, as well as part of Lake and St. Johns counties. And we asked Waltz if he believes we're getting ahead of the coronavirus.
Well, so far, I think we're getting ahead of it. It did obviously take the world by surprise, and it is spreading globally. But, like we prepare for hurricanes or other national disasters, this is about preparedness. The Congress did not move fast enough, in my view, but we did finally vote on a package yesterday. Our state and local officials are working hard on this, and fortunately, I think we're buying time until we get warmer weather. This is a winter virus, and I do expect and hope that things will get better as the weather starts to warm up.
Now, we want to hear from viewers like you. I just went on Twitter. I got 5 more questions from our followers. Everyone seems to be asking a question about coronavirus. They have so many concerns.
Absolutely. Channel 9 anchor Vanessa Eccles has been getting questions tonight. Vanessa, one of the questions people are asking is about what you heard Congressman Michael Waltz talk about, warm weather.
Exactly. Let's take a look at that. And the question is, will the warm weather help stop the spread of coronavirus? Dr. Johnny, we're going to ask you to tackle that one for us.
Sure. So I think that the winter virus concept really arises from the fact that this virus in particular seems to replicate at lower temperatures, like in the upper respiratory tract. It tends to do that. So people have a natural understanding that colder weather would certainly facilitate it. And by the same token, if you warm up the weather, that it should actually go away. There's a lot that we're learning about this virus. I think that is an optimistic projection that perhaps over the next few months, as the temperatures increase, we will see less coronavirus. That remains to be seen. We do know that it is different in that sense from influenza, that we clearly see a seasonal predilection, but we have yet to learn more about this particular virus.
We just have to wait in this case.
I think we have to be optimistic.
I like that. Let's do that. This next question. What's the difference, we've heard this term, between a presumptive case and a confirmed case? Dr. Martinez, if you can address that, because that's what we've heard. When we hear these cases, we hear a presumptive case of coronavirus.
The presumptive case would be a person that might have traveled to one of the places identified as high risk, that might be presenting some of the characteristics that we're looking for, flu-like symptoms, fever, and that has been tested, but has not yet been confirmed to have COVID-19.
All right, now we have about 28 million Americans and about 3 million Floridians who are uninsured. Here's the next question. Could uninsured patients who become sick potentially overburden our emergency rooms and increase exposure for the patients who aren't infected? Dr. Hendricks, if you can address, is that a concern at this point?
Well, definitely. Our concern with any type of outbreak like this, whether it's a heavy flu season or a new virus or pandemic, is the strain it'll put on our health system. So whether you're insured, uninsured, you will not be turned away at the emergency room. The hospital system, Advent Health, Orlando Health, I know we've all been working very hard on our plans and developing to handle those surges and developing unique and novel ways to manage patients. Urgent care, we see a lot of patients in urgent care. There's also telehealth, so e-care. We have e-care at Advent Health, where there's a cheaper alternative for care that's available, but nobody will be turned away for care in this city.
And the next question really piggybacks on that. Are there short-term solutions in providing immediate care for underinsured and uninsured patients infected with coronavirus COVID-19? Dr. Martinez, if you can address that, what are the short-term solutions?
Well, the short-term solutions is the health department is now doing the testing. As soon as the testing becomes available to a wider audience or to hospitals, the health department director has said that the health department does have a plan to address that, to address uninsured and underinsured residents.
Okay, let's take the next question. This is a good one. A lot of people have asked about this. What is the best way to clean or disinfect your home, your school, your work area? We'll go to Dr. Johnny for that. And I want to mention that you, for a decade, you were at the CDC. So when we talk about disinfecting the area, what's the best way and what do we do?
So I think that the household products and the commonly used products, certainly I believe it's the American Chemistry Association has a long list of actual products, and most of the time we know that the routine products for cleaning that either involve alcohol, 60%, 70% alcohol, or certainly bleach, and you can even have a dilute solution of bleach that you can make if you need to. But household products that are sold in the stores will be effective. And it's important to be thorough in terms of the cleaning process and disinfection. Cleaning is, of course, removing the debris and the dirt. Disinfection is just that. It's removing the infectious organisms.
All right, so if we can find those products, because we know that there's a shortage for some of them. I want to mention that our radio partners at News 96.5 WDBO are also taking your questions. So let's check in with Joe Kelly. Joe, what are you hearing?
And Vanessa, we're getting the same reaction that you're getting right now at Channel 9, and that is we've got a full board of phone calls. A lot of questions are coming in at 844-220-0965. We just heard from PJ in Sanford, and PJ points out that it's easier than ever before to get items shipped directly to us from China. And his question is there any concern about products that have been shipped to us from China or from Italy or any other hot zones of COVID-19?
Dr. Johnny, if you can address that one for us.
Right. I think it's pretty definitive that there is no real evidence that any packaged material would, in fact, carry the virus, certainly not for those distances and for that length of time.
Okay. Another question for you, Joe?
You bet. We also heard from Monica in Port Orange, and she picked up on a news story that has been reported that a dog had at least in part tested positive for COVID-19. But her question is, what about pets? Are pets safe from the spread of COVID-19?
And again, I think that COVID-19 is actually an example of a zoonotic virus where from wild animals, and in particular small mammals such as a pangolin, which is involved in illegal trade, can actually give it to human beings, but not the other way around.
Okay, some very good questions from our viewers there. Thank you to the viewers and thank you to our panel as well. We'll be right back.
Thank you, Vanessa.
Schools across Central Florida preparing, of course, just in case the virus spreads locally.
Channel 9's Michael Lepardi learned that some districts have ramped up their cleaning efforts.
With growing concerns about the new coronavirus, custodians in Osceola County are now taking extra steps to clean schools.
Wiping down hard surfaces, doorknobs, those types of things that sometimes they might not do every single day.
Superintendent Dr. Deborah Pace says the district just wants to be prepared.
We upgraded and updated our pandemic plan, so we have a plan. And you hope that you don't ever have to implement it, but it is important to be prepared. We just ask everybody to stay calm.
That's easier said than done, especially for some parents.
It's scary, you know. I'm scared, I'm terrified.
Orange County schools told us they're monitoring the situation, and Lake County schools are working to make sure soap dispensers are stocked. There are also simple steps students can take to protect themselves.
We're following guidance from the Centers for Disease Control that pretty much call for educating our students and staff about proper hygiene, hand washing, sneeze in your elbow.
Seminole County schools are working to disinfect school buses. We're talking about the seat belts and seat backs, as well as the railing where students hop on board. The district provided drivers with supplies this week.
We just want to be protective of our students as well as our employees, so we're going to do whatever we can to be good stewards for our community.
Should an outbreak happen locally, we asked administrators how they decide to close schools.
It's really going to depend on the situation and also the guidance that we get from both the state and local level.
Dr. Pace says closing a school is usually a last resort, but either way, the districts we spoke with say they'll keep parents in the know.
As we make decisions, we'll keep them informed. We'll even keep them informed when there's nothing new to say, because we know that people are concerned and they're waiting word.
Michael Lepardi, Channel 9 Eyewitness News.
All right, we want to hear right now from Orange County School Board Chair Teresa Jacobs. And what's the plan on how to communicate with parents if there is an outbreak here?
Well, thank you. Actually, I wanted to thank you for having us tonight because this is a great opportunity for us to communicate with parents. The other ways that we're communicating, we put out what's called a Connect Orange message, and it's to anybody who has a phone that wants to receive those messages. If they're not already on our list, they can call the school. And over the phone, they can give them their number as long as they have their student's ID number, and they'll be receiving these phone calls. And we're sending them out as often as we have any information to communicate on a variety of subjects, but certainly coronavirus is top on everybody's mind. So that's a major way of communicating. If you're not wanting to give out your phone number, you can go to our website at ocps.net, and we have an updated place on the face of our website. You can see it right there, and we keep that information updated, as well as crucial links that are helpful for parents to know what they can do to help at home. And as our peers around the region, we are doing the same thing. We are stepping up our disinfecting. We disinfect all of our schools, all of our classrooms every day. We have our custodial team check all of our bathrooms to make sure that soap dispensers are filled and working every day. So we understand how important that containment is, and we're doing our part, but we also want our parents to communicate with us if they see anything going wrong, because that's a huge advantage to us to have parents and children telling us if they see a soap dispenser that's not working. Unfortunately, for some reason, teenagers vandalize soap dispensers. I don't exactly know why, but that seems to be a problem.
Well, you know what? School is to learn, and this is a lesson that even the high schoolers and everybody else are learning more about, infectious diseases and making certain that others are safe. Thank you to School Board Chair, again, Teresa Jacobs, for being with us, and her comments that they thank us, we thank them as well for their expertise and their leadership during a time that has people concerned, but clearly there is a plan in place. Stay with us. Our coverage will continue right after the break.
Welcome back. Thousands of employees, millions and millions of visitors, billions of dollars. Central Florida's theme parks are critical to our local economy while also uniquely vulnerable.
No question about it. Channel 9's Christopher Heath takes a look at what the parks are doing as well and why it's so critical to be prepared for this and any future outbreaks.
3 Disney parks in Asia already shut down. Museums and attractions in Europe closed. And as coronavirus arrives in Florida, area theme parks know difficult decisions may need to be made.
You're faced with, huge guest issues that, how do we get all these guests back to where they're supposed to be?
Former UCF professor Duncan Dixon is an expert in Central Florida's theme parks.
What to do with all these people, and then what do you do with your cast, your team, your employees? Do we pay them? Do we not pay them?
The Disney parks in China were shut down by the government, which is part owner of the parks. That's not the case in the United States, where Disney would have much more control, and the outbreak has been much less severe. Even still, the major parks, including Universal and SeaWorld, are taking precautions to protect guests. With both telling Eyewitness News in statements, they're redoubling cleaning and communicating with staff about what to look for and what to do.
They're getting their plans together. They've got people in place. They're doing those kinds of things. They're coordinating with the Center for Disease Control. They're coordinating with the federal government, state government.
The other thing Dixon notes is that these plans won't go away when the virus does. In fact, since 9/11, when the theme parks shut down just hours after the attacks, all theme parks have drafted contingency plans for what to do in an emergency.
But now everybody's got that plan in place that if this happens, this is, what we're going to do.
Christopher Heath, Channel 9 Eyewitness News.
Okay, tourism is one thing. Of course, we talked with Orange County Mayor Jerry Demings about this. $154 million, you announced, Mayor, has been lost already in conventions. As it relates to tourists, how do you make certain that tourists, either in the United States or internationally, know that it's safe to come here and that precautions have been taken?
Well, we obviously have to continue to make certain that we communicate to the public. When we look at our tourism business, only 0.3% of the people who travel here come from the impacted countries in question. When we look at all of the major metropolitan communities across America that have a convention center, all of them have been impacted somewhat from canceled shows, et cetera, and we have certainly been included in that number. And just within the last 24 hours, we had 3 shows that canceled. One's primarily because of the healthcare industry and its conference attendees would have been disproportionately impacted by it had they traveled here. And that was the Health Information and Management Systems Society, 43,000 attendees, a loss of an economic impact of over $113 million here for our community. So it is significant, but we remain open here. We do not have any cases. So based on what you've heard from the physicians here and other experts, we are at a low risk. And so what we're saying to the public, we're still open. Come here for your spring break, come here for your vacation. We believe that we will see a net gain from domestic tourism during the coming months and weeks.
Phil, someone just asked me this quickly, should you be screening passengers that are coming internationally?
Well, first of all, the screening is with the health department CDC direction. So the airport itself doesn't screen. So we look to them for guidance. We're not at risk at this point. We don't have direct flights from any of the hot spots. We have no instances in Orange County or at the airport of any of this. So if that arises, we'll coordinate, as we always do, with the health department, CDC, and establish what needs to happen in terms of what happens on international flights. Customs and Border Protection has a lot of information. They continue to be on the forefront, and they also coordinate with CDC if there's an instance of any passenger on a flight that may present symptoms.
And Mayor, back to you, so many times, so many employees, they need that paycheck, they're not feeling well, and they feel the pressure of they have to go to work. Should there be mandatory paid sick time for all of Florida's workers, and wouldn't that kind of measure maybe prevent the spread of a pandemic?
I think our employers here within the state and locally are going to have to make some common sense decisions about their employees. If an employee potentially has traveled to one of the impacted areas, we certainly don't want them to come back into the workspace if it's during that period of time that they could perhaps transmit some type of a virus. Otherwise, I think we really have to continue our cleanliness efforts throughout the region. The byproduct of what is happening now is that we're probably as clean as we've ever been with all of the protocols that we're putting in place as a community.
Maybe we've learned some lessons as well through the hurricanes. Possibly, you know, that reimbursement would keep people home if they're sick, and then those companies could be reimbursed for paying their folks that didn't come to work that day.
All right, stay with us. Our coverage continues right after this quick break.
Rapid fire questions and answers. We have 2 minutes left. I'm going to start with a Twitter question right now, and this one will be for Orange County School Board Chair Teresa Jacobs. OCPS teachers, this person writes, are watching the special. They say that the custodial staff is not disinfecting classrooms every night, even though they're supposed to be. What do you react when you hear that?
That's unacceptable. If that is the case, and they know that is the case, please report it to the principal. If that doesn't work, report it to either to me or to the superintendent at supt@ocps.com.
Another question I'm getting right now on Twitter. Local government official can answer this one. Will any local governments be making it mandatory for malls, stores, shopping centers, restaurants to have hand sanitizer or wipes? We know the airport has it all over. Schools now beefing that up. Will there be any
What we've asked our public to do is to follow the CDC guidelines, and if they follow the guidelines, they want to stay in business as well, so it really makes good business sense to follow those guidelines.
Dr. Johnny, how long does this virus lie in your body? Do you have to exhibit symptoms to have the coronavirus, or could you be holding it and give it to somebody else?
From the time you get infected to the time you actually have symptoms, it's about 5 days. During that period of time, most people think that you are not contagious. There have been some concerns about asymptomatic transmission, but right now we think that you're not contagious during that period of time. After you get symptoms, it may last for about another week to 10 days in most people, so you would be contagious during that time period when you're sneezing and coughing.
All right, I want to thank all of you. There was 2 minutes. That's all we got.
We do want to thank you for joining us for coronavirus. We keep getting our Twitter feed flooded every minute with new questions, but we hope that we were able to answer all of your questions.
Absolutely. We'll bring you the latest developments on the coronavirus as well as the rest of the day's other major stories and forecast tonight on Eyewitness News at 10 and 11. Take care and wash your hands.
20 seconds.